On the evening of Saturday, October 15, 2023, Montgomery County Fire and Rescue crews were dispatched to a residence in Gaithersburg for the report of a patient with decreased level of consciousness. En route to the call, the incident was upgraded to a cardiac arrest. Upon the arrival of MCFRS crews, the patient was found lying on the kitchen floor. The patient's wife advised that 30 minutes earlier, the patient was acting confused and not like himself at all, as well as complaining of discomfort in his chest. The patient's wife then heard the patient fall, and when she went to check on him, she found him to be unresponsive with agonal breathing, so she immediately called 911 for assistance. MCFRS crews performed a quick assessment and found the patient to be pulseless and apneic. High-performance CPR was initiated, an oropharyngeal airway was placed, ventilations were assisted via bag valve, and the patient was placed on the cardiac monitor. The initial rhythm was ventricular fibrillation, and the patient was defibrillated. High-performance CPR was resumed, vascular access was obtained with an IO, and epinephrine was administered. During the second pulse check, the patient was found to be in PEA. After 6 minutes of chest compressions, the patient had a return to spontaneous circulation. The crews administered lactated ringers and administered an amiodarone drip. As the crews worked to stabilize the patient developed a gag reflex and the oropharyngeal airway was removed. The patient has spontaneous respirations but still required assistance via bag valve mask. A 12-lead EKG was acquired and a ST elevation was noted. The patient was quickly packaged and moved to the EMS unit for transport to Shady Grove Medical Center. En route to the hospital, the crew worked together to establish a second vascular access site, perform a consult with Shady Grove and declare a STEMI alert, transmit the 12-lead EKG, continue to assist patient ventilations, and monitor the patient's vital signs and conditions. Upon arrival at Shady Grove Medical Center, care was transferred to the waiting emergency department staff. The patient was stabilized in the emergency department and then taken emergently to the catheterization lab. The patient was transferred to the intensive care unit where his condition continued to improve. Thanks to the skills, teamwork, and professionalism of the MCFRS crews and the excellent care provided by Shady Grove Medical Center, the patient was discharged home, neurologically intact, on November 2nd, 2023. Mr. Freeman's here too. Come up and take a picture.